LySon Island has an area of about 10 square kilometers and a population of about 22,000 people. It is an island district with difficult geographical conditions, especially during the stormy seasons. Previously in 2010, a military-civilian medical center was established in the district. However, quality infrastructure was still lacking, which led to difficulties in medical examination and treatment for the people on the island.
My name is Nguyen Ngoc Con. I am 51 years old and a resident of LySon Island. I am a fisherman. When we, the people of LySon, suffer from illness or have severe back pain like I do, we have to rent a boat to visit a hospital on the mainland. Unfortunately, when the weather conditions are bad, we cannot arrange for boat travel. In addition, the cost of renting a boat is high, which is a financial burden for us. Travel to the mainland usually takes a whole day, and the illness could worsen.
Since the establishment of the new military-civilian medical center, with a capacity of 100 beds and relatively modern equipment, there is a big leap in medical examination and treatment, especially with the application of X-ray and CT. The deployment of the new equipment supports screening and early detection of several diseases. It also boosts the doctors' confidence in their daily routines, allowing them to treat patients promptly while reducing the number of referral cases, about 150 to 200 annually, owing to the lack of facilities in the past.
With the deployment of CT, we are now able to diagnose diseases, such as lung tumors, pleural effusion, pneumothorax, and appendicitis. The mobile X-ray machine helps patients with difficulty moving. For example, accident patients with broken ribs or respiratory failure require the machine to be brought to the patient's bed for emergency imaging.
I am very pleased. The hospital on the island has not had a CT machine until now. I am glad to have received a CT scan earlier this morning. It helps a lot in saving cost and time spent traveling to the mainland.